I now recognize Ms. Tinney from New York for 5 minutes.
Thank you, Mr. Chairman. Thank you for holding the meeting, and thank you to the witnesses for being here on this very important topic. I've heard the Democrats on this committee and their witness, Mr. Woodhouse, absurdly framing the affordability crisis as a result of H.R. 1. Well, as a New York resident and a New York business owner, I can tell you this healthcare affordability crisis has existed for years in my state, and it lies solely at the feet of Albany bureaucrats, which for decades have saddled working-class families and small businesses with exorbitant taxes on private insurance. The truth is that Kathy Hochul and Albany Democrats, and I served in the state legislature, operate a healthcare financing system that extracts at least $6.6 billion in hidden taxes from working families for their health insurance, maximizes federal cost shifting to cover their own budget failures, and insulates powerful institutions from accountability, all while calling itself a model of progressive governance. The result is the #1 highest employer-sponsored health insurance premiums in the country. Not second highest, first. $9,589 for single coverage, $27,188 for family coverage. And I have a family business, and we are now paying in excess of $30,000 for a family in rural upstate New York. There are 15 to 20% higher than the national averages, and just think of what our small family business does, founded by my grandfather, who, by the way, founded a community hospital in the little hamlet of Hamilton, New York. And the state just approved premium increases from 7 to 13% for this coming year. Now, Mr. Woodhouse, I heard a little bit of his testimony, is not a physician. He's not trained in healthcare. He's a political operative and worked with President Obama to create what I think is one of the worst things that's happened to our country and our small business community, and that's the ACA, otherwise known as Obamacare. Mr. Woodhouse, you said in your testimony that there are 5 hospitals in my district, New York 24, that are at risk of closure because of H.R. 1. I have no idea where you got that idea, and I question the credibility of your source on that. But I can tell you every hospital in my district, and probably every hospital across the state, makes up the difference from commercial payers becoming fewer by the year because of the Albany Democrats and their disastrous policies and what's happened since the advent of the Obamacare system. So, Mr. Woodhouse, you came here today to talk about working families being squeezed. So did those families know they were paying $1,760 a year in hidden Albany taxes on top of their already skyrocketing premiums? Is your organization advocating to reduce those taxes? That's a rhetorical question. Do you believe that collecting $6.6 billion a year in hidden taxes on health insurance, including a covered lives assessment for the professional education pool, the state-run GME program that hasn't been funded since 2008, preceding Obamacare, lowers premiums for working families and small business owners and employees? These taxes hit a mechanic in Oswego, my home county, the exact same way they hit a Wall Street executive in Manhattan. So Albany built a public coverage program that was bankrolled off in exorbitant subsidies for non-citizens, priced private insurance out of competition for nearly 10% of the state's population. Is it progressive to pull healthy people out of the private risk pool, concentrate the sickest and most expensive patients in what's left, and then call the resulting premium an explosion of a federal problem? This is a New York State problem that is on top of a huge federal problem created by Obamacare, not H.R. 1. Mr. Woodhouse came here to tell this committee that Washington is responsible for America's healthcare affordability prices. But New York Story tells you different, and everything you need to know about where that framing breaks down. Albany created a tax in 1996 to fund doctor training, aside from the fact that our state is already the #1 beneficiary of federal GME funding. They killed the program in 2008 and kept the tax. They created a coverage mandate and diverted the revenue. They built a zero-premium public program on federal dollars tied to a 30-year-old eligibility rule with no contingency for the day that rule was reasserted, and called it sustainable. They layer mandate after mandate onto private insurers every single session and private employers. They run an indigent care program that sends more money to well-resourced hospitals than the safety net institutions in my communities that actually serve the poor. And they have been doing all of this for decades while presiding over the highest employer-sponsored health insurance premiums in the country that is bankrupting our employers across New York State. New York is not an outlier. This is a preview of where the Democrats' health care policies will lead us. And I agree with Dr. Murphy. The dream of Medicare for all is absurd. We have to stop this nonsense now. Affordability is because of the ACA and because of states like New York. I yield back my time.